Rhode Island state senators serve on committees, introduce bills, and enact laws, and confirm judicial appointments and gubernatorial appointments. So today, in this edition of CriptheVote, we will be discussing these duties with incumbent Rhode Island State Senator Dawn Euer. We will also address accessible campaigning and the impact some federal changes might have on Rhode Island residents with disabilities. I'm Annette Bourbonniere, and this is CriptheVote, a sub-series of Nothing Without Us, stories and discussions of meaningful inclusion. I am a 70-ish-year-old woman with white hair, with gray hair, excuse me, not yet, dark rimmed eyeglasses, and sitting in a power wheelchair. Please take the time to free subscribe if you've not already done so. Give me a like and make some comments. I read all the comments. All podcasts are available with captions in English and other languages that are available in the settings of your browser. So today I am honored to have as my guest Senator Dawn Euer, who is a senator in the Rhode Island State Legislature. Welcome, Dawn.
Yeah. How are you? Thanks for having me. I'm good. Loving the rainy day that we've got here and beautiful scene.
Right, over the playground. Here you go, over the park.
Exactly.
Yep. So we have talked before. You and I do know each other, so we're going to have a little full disclosure here.
Yes.
We've done some work before. Mm-hmm. So the purpose of this podcast is that nobody talks about disability policies or disability issues during campaigns. So this is a take on the CriptheVote sub-series. With CriptheVote movement was started by Alice Wong, the late Alice Wong, and two of her associates who are still active, Greg Barrington and Andrew Fullering. Mm-hmm. And the idea is to start communicating about disability because 29% of your potential voters have a disability. And so that's an important thing. Mm-hmm. So we're also asking people, because 29% of your voters have a disability, can you pledge to campaign accessibly? What we're asking is for people to hold events in accessible locations, mm-hmm. which I know is hard in Newport. They're kind of challenging to find. But it's important that we try, and that and that we do this. I do have a pledge that is posted on my Patreon page, and I can also send you a copy of it if you would be kind enough to do so.
Yeah, I'm happy to take that pledge. Yeah.
Okay, that's great.
Yeah.
I'm happy to hear that too. So, okay, so we like I said, Dawn Euer here is a state senator, and in the Rhode Island Senate, it's one of the two chambers. We have a House and a Senate in a little tiny state. We have a lot of people in office. The senators serve on committees, introduce bills and enact laws, and they confirm judicial nominations and gubernatorial appointments.
Yes.
And that's an important part of this. They're elected every 2 years. And that's the most important part. So I have a whole list here of appointments that governor has, but I don't know that
it's a lot.
It's a lot. It is a lot. Right?
Yeah.
So I'm not going to make you go through them all. Okay?
I don't know that anybody knows all of the appointments that we have authority over. It's a lot.
You can download them from the website.
Yep.
Although it did take some looking, took some searching to find it.
Yeah.
But some of the things that I get concerned about are, our own representation. There is none of these appointments are specific to people with disabilities.
Correct.
We don't have a voice, a specific voice in government. We have one organization, it is a pseudo-state organization, the Governor's Commission on Disabilities, mm-hmm. That has no power and very, very limited funds. Mm-hmm. What needs to be done to elevate the secretary of the commission to a cabinet level position?
I mean, I think political will, really. I think that's definitely something that I think that's definitely something that's easy enough to do if there is, and of course, then the pushback is always going to be the budget, as you know. That will constantly be the pushback. But
Yeah.
but I think even so to your point, that commission, they do come in and provide testimony on any assortment of bills in the different committees over the course of the year. And so, I do think that even though they are not a cabinet level position, and even though they do not have a large staff or a large budget, I do think that there is a lot of deference when they come in and they weigh in on stuff.
Right.
But
Well,
yeah.
but I think it's important now for that to have some recognition, to have some formal recognition.
Yeah.
Because there are people who work with disability that have no clue, and the Governor's Commission has people with disabilities.
Right.
Yeah, and people that know the life.
Yeah. Well, and I think one of the benefits of raising it to the cabinet level position, like you're suggesting, is to allow it to have almost an integrate that perspective into all of the decision making. As much as there are any, cabinet level convenings, having that voice at the table so that it can be integrated into the whole set of policy coming out of the governor, I think would be a great advantage of having it a cabinet level position.
Yeah.
Yeah.
I think it's time. I do.
Yeah.
Because we are 29%, 1 out of 4 of you voted.
Yeah.
26%. I'm sorry, not 29, 26%.
Yeah. That's
But it's 1 out of 4
That's right.
of your voters. Yeah. I don't like quoting wrong statistics.
Yeah.
I have a problem with that.
I mean, I'd be happy to help support that and
Yeah.
work with you in getting that done.
Okay.
Yeah.
That would be great. I mean, because we have a lot going on right now.
Mm-hmm.
I think it could actually, you talk about budget, I think it could save some money.
Yeah.
And the reason I say this is when there are issues that come up, we go outside and hire these
Consultants.
very expensive consultants
Mm-hmm.
who know a whole lot less about disability than most anyone else.
Yep.
They're not focused on disability, they're focused on process.
Sure.
And, and you can have the process here and the disability here. They don't necessarily meet.
Yeah. Yep.
And so that's wasted money.
Yeah.
You might find some very talented people with disabilities who are as good at that process.
Yep. Yeah, that totally makes sense.
Yeah. So I think that we really need to start looking at people with disabilities as a resource, a valuable resource, rather than just always complaining, the budget, well, you can't do that,
Yeah.
Oh, they cost so much money. They cost us a lot of money too, trust me.
Yeah.
But we do have some value, and I know some very, very talented people with disabilities.
Yeah.
So, of course, right now, we are under attack in the most egregious way from the federal.
Yes.
And it's terrifying.
Yeah.
It is really, really scary. And we're not the only ones. I mean, immigrants are, people with black and brown skin are, women in general are.
Yeah.
And, I was at an event recently and a black woman mentioned, she was a Trumper, and it broke my heart that a woman of color who is so despised and so looked down, so devalued in every way by this administration, would think that this is a good administration.
Yeah.
But people with disabilities are going through it.
Yeah.
One of the ways is, they're trying to make Section 504 of the Rehab Act, unconstitutional, and they're coming after the ADA too, I'm sure.
That's correct.
Now, I know that Rhode Island, thankfully, and I'm thanking you as among others, a couple of years ago codified the Rehab Act, that
Yes.
Section 504 into Rhode Island law.
Yes.
But will we have the funding to keep that commitment?
Yeah. Yeah. I mean, I think, I'm glad and proud that we did that. And I
Yes.
think that I actually want us to continue looking at all of those attacks on the federal level.
Mhm.
Also, whatever nonsense SCOTUS is up to. So it's
Yeah.
the administrative rulemaking, it's the legal challenges, all of that. And I think we need to be taking like a forward view on it to make
Right.
sure that we're shoring that up. And I think to your earlier point, we can't afford to not have those protections in place, enforce them, and make sure that, we are, we're protecting and providing for all of our Rhode Island residents, so,
Right.
yeah.
Well, we also don't want to lose some of the gains we've had.
Correct.
One important one is special education. I mean,
Yes.
they are really determined to get rid of special education.
That's right.
Well, as part of 504, this will stay if it's funded. But special education works.
Yes, yeah,
It really works.
Yeah, it
And,
does.
and I've done some teaching on the university level.
Mhm.
And yes, we do have more students looking for accommodations, but that's because it works.
that's right.
And they've been able to get to college.
Yeah, that's right.
I have seen people with some incredibly challenging majors that unfortunately there's still some pushback about, well, how can you need accommodations if you do? Yeah, it's because I had the right tools. Is how I give them the argument to go back with.
Yeah.
I had the right tools, and that's why I can do it.
That's right.
There are people with Down syndrome that have gone to Harvard now.
Yeah,
And because we've learned how to teach them. Not
right.
that they are not different, it's just we found a way to unlock their
That's-
potential.
that's right.
And I think it's really important to know that we're building good citizens this way.
Absolutely. Yeah.
Contributing members of society.
Yeah,
And that's a really important thing to keep in mind.
yeah,
So I hope we're able to fund it because we need to keep it.
yeah,
So same with the whole institutionalization thing.
yes.
I'm old. I've been around a long time. I was working in the mental health system when we deinstitutionalized and we started closing down the IMH. And I saw what institutionalization had done to some of these people.
Yep.
Because it's not just their illness, it was the institutionalization. And then I've also met many people who had been who were raised essentially at the lab school.
Yeah,
And I'm pretty sure Dr. Ladd didn't intend for the amount of abuse and neglect that had occurred, but it's institutions are prone to that kind of abuse and neglect.
yes, yeah.
And,
Well, and especially if your viewpoint on the institutionalization is a cost-saving measure or whatever sort of nonsense.
absolutely not. It's the opposite.
It's not, unless you're going to run crappy institutions that are going to lead to those types of outcomes, right? And so I think that that's the kind of driving force behind the mentality that the federal administration has in pushing all of this stuff. Tells you anything you need to know about what that would look like and what the outcomes would be for the people who get subject to that treatment.
Yeah.
So,
Yeah, what I think of, and this is maybe my own conspiracy theory, I don't know, but they've been buying all these warehouses for detention. Now, why they want to detain immigrants that they're supposedly planning to deport, this is getting really bad. But they have not filled these warehouses, and I'm thinking that that's what they're trying to do.
yeah.
Is use the warehouses to, essentially, confine people with disabilities. And it's wrong. They shouldn't be using them for what they are now. I almost think we're close to what Nazi Germany was like 100 years ago. We are on that cusp, and
Yeah.
and it's scary to think about. But I did a whole episode on the institutionalization, and I included Geraldo Rivera's expose of the Willowbrook School and a documentary on the law school. So
Yeah.
anybody that has the stomach because it's really hard to watch.
Yeah.
But it's a good reason why we cannot do that to people who are ill. And,
Yeah.
um,
Yeah. Well, and I think I think sometimes, when you make that comparison, I think there's like the online thing, right? Like anytime you bring up Nazis, like you lose the argument or whatever. But the reality is that if you actually know the history and you know how the march, like it didn't start with the gas chambers, right? And that's not where it started. That's why it's so important to like recognize where those parallels are. And to like call out, because they did start with people with disabilities. They started with gays and lesbians. They started, so it's like how they started and where they ended up.
Right.
So I think it is super important to like highlight what is happening so that we stop it and don't let it continue.
Right. And I think that's important that we recognize it for what it is.
Yep.
And because it's going to take us some time to recover from this administration.
Absolutely.
It's going to take at least a decade.
Yeah.
Maybe a whole generation. Maybe two.
Yep.
And it's terrifying. But we need to consider this as very important because we don't want to lose all that we've gained.
That's right. That's right.
And right, let's just talk about, let's talk about Medicaid work requirements, and it's going to tie into the whole poverty rules that we have anyway. Okay, I'm sorry, I want to make sure it didn't stop.
Oh, yeah.
So, the Medicaid work requirements, okay, so we have a snake oil salesman that's putting this through. I'm sorry, that's the nicest thing I'm going to say about him. And there's just no connection. I don't know how he has a medical license, to be honest with you. He has no concept of disability and Medicaid. And when he talks about fraud and abuse, he needs to look to Washington, D.C. first. To people that are elected officials, and we have a bunch there that do not belong there. And you want to stop waste, fraud, and abuse, you start right there. In Congress, in the Cabinet, White House. We need to start there, and that's where we're going to end it. But getting back to the work requirements, there are a couple of things about this that are going to be really challenging. The requirement is going to be that in order to get Medicaid, you'll have to work 80 hours per month unless you can be declared federally, not federally, unless you can be, fragile, physically fragile, I'm sorry, not federally. Physically fragile, excuse me. But that train almost went off the track there. And so let's talk about the physically fragile first, because that will end up putting more people in institutions and nursing homes.
Yeah.
And that is the whole purpose of it. I'm not going to sugarcoat this because it's scary and we need to stop it. Somebody that's declared physically fragile is not going to be allowed to live in the community.
Yeah.
Now, working 80 hours a month, we have a whole other issue that we need to work on, because there are people who, for years, have been pushed into poverty in order to maintain their Medicaid status. Otherwise, they lose it. Now, I'm one person that if I were to give up Medicaid to work, I would have to earn over $150,000 a year to live at the poverty level.
Yeah.
So this is, not a realistic thing.
Yeah.
I don't want to be considered medically fragile.
Right.
Because I should be able to work a little bit if I can.
Right.
And I should be able to do it without penalty.
Yeah.
I think I still have something to give to this world. There are some that would
argue otherwise, but, you know, I am committed to what I'm doing right now. And so I don't know how we're going to be able to stop this. Is there anything that we can do on the state level to address it?
Yeah, I mean, that's one of those things where, because I have lost track of where the rulemaking is. It's not finalized though, right?
It's not finalized, but it's
Yeah,
getting
everybody
there.
thinks that's going that direction and it'll
Yeah.
be finalized with that language.
Right.
Yeah.
Right.
I mean, that's one of those things where it is such a challenge to make up on the state level, because I think the ways where, you know, creating some sort of like state level benefit to kind of
Right.
smooth out that gap, but again, that comes into like political will and, you know, budget allocations with everything else.
Yeah.
But I do think that, you know, pushing back against that rulemaking, and I don't know, you know, I don't know what sort of national effort that there has been. I have seen some
Yeah,
some
there's-
effort on
yeah.
that.
Yeah, the American Association of Persons with Disabilities.
Right.
The disability
Yeah.
research, no, disability, yeah, research and education defense fund.
Okay. Okay.
Yeah, I mean, those are national organizations that are really doing, and then there's the National Disability Rights Network.
Yep.
So, I mean, there are organizations that are doing things.
Yeah.
But we all have to fight back at
Yeah.
every level that we can.
Yeah.
I know that long-term, and this is a federal thing that we need to do, when we elect any federal officers now, we need to require two things of them. One is integrity. We can no longer
Yeah.
afford to vote in people who are marginal or worse.
Yep.
The integrity is critical. And the second thing we need from them is boldness.
Mm-hmm. Yeah.
And because, you know, it's been brought home many times that out of all those countries here for the cup, the soccer.
Oh, FIFA?
Yeah,
The World
right.
Cup. Yeah.
The World Cup.
Yeah.
I'm not a FIFA fan. I'm a tennis fan. But,
Sure. Yeah. Yeah.
Out of all those countries represented here, we were the only country that does not have universal health care.
Oh, yeah. Yep.
And there is no reason we cannot have free universal health care
That's right.
in this country.
Yep.
And then we don't have to worry about Medicaid, and
That's right.
people with disabilities can live their lives
Yeah.
without having to have that stressor over us
Yeah.
all the time.
Yeah.
Because that poverty rule that we're always required to maintain is a significant stressor.
Yeah. Yeah.
Because it's not hard and fast either, by
Yeah.
the way. It's a moving line,
Yeah. Yep.
and, you know, it's just not really right.
Yeah.
And it's not the way to treat people.
Yeah.
It's from the 1950s, I think, you know, but
Yeah.
if you look at, and okay, the economist in me is going to come out here.
I love it.
Okay, so enforcing a poverty rule just makes people not contribute.
Yeah.
If you don't have a poverty rule, people are going to work to their best ability.
Mm-hmm.
Now, that may not be full-time, it may not be, you know, there are a lot of things a lot of people are not going to be able to do.
Yeah.
But if people are working to their best ability, whatever that is,
Mm-hmm.
we're then paying taxes.
Yeah.
So poverty doesn't pay taxes.
Yeah.
You're working, you're paying taxes.
Yep.
Then you're also, because you're having a little discretionary spending here, you're buying goods and services. And if we're buying goods and services, then more people are working.
Yeah.
And more people are paying taxes, and those people are buying goods and services, and it's an economic driver. This is basic,
Yep.
basic economics here.
Yeah.
Keeping people poor puts a lid on all of that.
Yeah.
And so we need to get smart about this.
Yeah. Yeah. I mean, you know, I'm a big fan, and I've always been a co-sponsor on the bills to do single payer, whatever the name is
Not
of
even
it
single
today.
payer. I think we need to have free universal health care.
Yeah.
Because if you have single payer, you're still gonna have people that can't afford it, because that's what this government does.
Yeah.
If we have Medicare for all, there are gonna be people left out that cannot afford it, cannot afford the
Yeah.
co-pays and the
Yeah.
deductibles. We cannot afford to do that anymore.
Yeah.
We need to have, we have the money.
Absolutely we do. Yeah.
This country has the resources.
Yes, that is
I mean, if
correct.
we did a one-time 50% tax, wealth tax on billionaires,
Yeah.
we would be able to fund the whole thing.
That's correct. Yep.
And there's no reason we can't do that, because they're not using that money. They
They
hoard
can't.
it.
They literally can't.
They'll never spend it in 10 lifetimes.
Yeah.
What they are is doing it for status. You know, I got more than you do. I
That's
made
right.
it to trillionaire. Ha ha, look at me.
Yes.
Let's say, are we aiming for a quadrillionaire? You know, like, there
Yeah.
is no advantage to them at a certain point.
Well, and there's no benefit to society either.
None whatsoever.
Like,
Yeah.
so that they can blow up more rockets over Florida or Texas or wherever they
Yeah,
are right now.
Yeah.
Yeah, no.
Yeah, and Jeff Bezos lately has been saying, well, you know, it's going to hurt business. You know, that's baloney.
No.
That is absolutely baloney. Pay your employees more.
That's
Because
right.
if we had a living wage, there wouldn't be a problem.
That's correct.
You know, there's that too.
That's correct.
So, you know, I'm not, you know,
I mean, I would love to reduce government spending, but to do so, the private sector has to step up, right? And if they're going to just continue to increase the wealth gap,
Right.
and you have all these major corporations where
Yeah.
you have full-time workers who are still getting food assistance and rental assistance and everything
This
else
is it.
because they cannot survive to
Right.
live.
Right.
Like, they're obviously not solving the problem. So
Right.
yeah,
exactly.
as a state elected leader, I am getting a lot of criticism about the state budget. And,
Yeah.
part of the problem is that the federal government is rolling back all these programs. And then we saw what we did during COVID, where we enhanced all of these social safety net programs. And
Right.
guess what? People
Yeah.
were able to be fed, children were able to be fed, and
Yes, right.
people were not getting evicted because they were able to make their rent.
Right.
Those types of things like creates a
Yeah.
better society versus somebody hoarding so that they can be on the trillionaire list. So
Right, yeah. You know, and we shouldn't be terrified of taxes.
No.
Taxes can be a very predictable expense.
Mm-hmm.
But if you're getting what you need from taxes,
That's right.
for example, the free universal health care, then you have more discretionary spending. You're not worried
That's right.
always about that next $1,000 emergency that's going to put you
Yeah.
under.
Yeah.
And that's, that's a reality. And you can be fair about it. We just need better elected officials that are bold enough to say, this is how we're going to do it.
Yeah.
I mean, I give Obama credit for giving that step try, because it was all he could do then.
Right.
But obviously it's pretty vulnerable, and
Right.
we need to be able to do more. We need to say, oh, okay, we know it worked. Now we need to make it work for everybody.
That's
And-
right.
And that's what we need to do.
Yeah, that's right. Well, and I think that's, this is the problem, and exactly I think why bold leadership is needed, because when you get these, like, the kids will call it a mid, if it's
Right.
this mid approach to whatever, when most people understand we actually need structural changes,
Yeah.
and pushing for those structural changes feels scary to a lot of, longtime politicians who get their donor base from those entrenched interests who want the systems constrained and operating as they do now. But we do need to holistically transform so many of these systems so that exactly what you're saying, that people, when they're paying taxes, they wouldn't have as much of a problem paying taxes if they felt like their roads were not, bridges were not falling down, kids got a good education, people had health care. So all of these things that your taxes are supposed to pay for, but they don't, because we have a mid approach to it. And so if
Yeah.
we're not willing to go for that structural transformation, people are going to be rightfully frustrated when they have to pay their taxes, and those taxes keep going up incrementally to not fix any of the problems.
Because our healthcare system right now
It's so broken.
It is horribly broken.
It needs a complete tear down and overhaul.
Oh, yeah.
I mean, that's why
We have antitrust violations all over the place.
Right.
Again, if we had free universal health care, we could
Yeah.
get the giant corporations out of the healthcare business.
Yeah, that's right.
Doctors could be doctors and they could talk to patients. And
Imagine that.
Yeah. You know, and it would not be an ongoing problem.
Yeah.
And, you know, it's, you know, and the system is so precarious as it is.
Oh, yeah. I mean, our big, you know, bold move on healthcare this year in the General Assembly was to bail out a hospital.
Right, yeah.
Like, I mean,
Right.
we were able to move swiftly on that to do
Yeah.
some, you know, state-backed bonds, but,
Right.
you know, that's.
But even still, the hospitals are extremely inaccessible.
Well, I don't think you caught my sarcasm. I was being sarcastic about that.
Yeah.
I mean, I'm glad that we did it. We needed to save it, but it's not getting to your point. It's not getting to the root of the problem.
Right,
It is a
exactly.
Band-Aid on, I don't know, a Band-Aid on just this chasm.
Yeah.
Putting a Band-Aid in the Grand Canyon.
Right, exactly.
So,
Yeah.
yeah.
Yeah, you're right. I missed that.
No, that was total sarcasm. I mean, I voted for it because we needed to do it, but it was just like,
Yeah.
what are we doing here?
Yeah,
Yeah.
right.
Yeah.
So, okay.
Yeah.
Well, I know we didn't solve all the problems of the world, but we tried.
Yes.
And I do thank you for coming and having
Yeah.
this conversation with me.
Yeah.
I'm glad you're willing to talk about the disability issues. And-
Absolutely. Happy to anytime.
All
Yeah.
right.
Yeah.
Okay, well, take care and
Thanks.
wish you luck.
Thank
Okay.
you. Thanks.
Okay, bye.
Thank you for listening to this conversation with Rhode Island State Senator Dawn Euer. As listeners to Nothing Without Us, you can participate in the CriptheVote subseries. Let me know what candidates you want to hear from. What do you want them to know? What questions do you want answered? And let me know if you want to join me in that interview and information session. While Nothing Without Us should be a place for many voices to be heard, and while I think I'm pretty in touch with disability issues, I'm sure some of you will think of things I do not. If this is to be a lively community, then you should have a seat at this table. It is through empowering ourselves that we will be able to protect our rights. So let's do it. You can tell me in the comments who you want to hear from, what questions you want asked or discussed, and if you want to join in this interview. Let's make all of our voices heard. At this time, I am trying to get as many candidates in before the Rhode Island primary, especially those that are running in the primary, as I possibly can. The focus of these discussions will be about disability and how laws and policies affect us, because this is never discussed when, during other campaigning. So I have published a pledge to accessible campaigning that is posted on Patreon. Please download it and give it to every candidate you encounter. Let them know that the disability population comprises 26% of their voters and that they need to consider this when campaigning. Signing it will tell that 26% of voters that we matter. It will also indicate that they do not pick and choose which laws they're going to uphold. And that's a quality we really desire from our representatives in government. Most of all, please remember that your superpower, whether you have a disability or not, is voting. Even if you've never voted before, this year is critical. Many of our rights as persons with disabilities are in jeopardy. If you are in Rhode Island, August 10 is the last day to register to vote in the primary. Then that primary will be September 9. If you have not already done so, please contact your local board of canvassers and make sure you register in time. If you are seeking a mail-in ballot for the primary, you must request it by August 19, 2026. The primary early voting and emergency mail ballot period is from August 20th, 2026 to September 8, 2026. So thank you for listening. I'm Annette, and this has been Nothing Without Us. Please subscribe to this podcast. Even free subscriptions will give you access to all the regular and important episodes, including the entire CriptheVote subseries. Share this podcast and make some comments. I read them all. Now, while the basic subscriptions are free, there are benefits to paid memberships, including early access to some postings, special postings that are only available to paid members, and a monthly live episode to those on the activist tier. My goal is to make this a lively community where voices will be heard. You now have the option to purchase memberships on an annual basis rather than just on a monthly basis, and you can gift a membership to someone else. Now, I do all the writing, editing, and posting, as well as managing the technology for this podcast. I need to make it grow so I can get some help with this. So please subscribe, and if you are able, help support this podcast with a paid membership. Telling your friends about it helps as well. Let them know that they can find this podcast at patreon.com/nothingwithoutus on YouTube and Spotify. You can also find me on LinkedIn, Blue Sky, Instagram, Facebook, and Threads. So until the next Nothing Without Us, I'm Annette.